Hello, and welcome to our NASCO Healthcare Training Session. My name is Anna, and next to me is our training manager, Khaled.
Hi.
And also joining us today through Zoom is Melissa.
Good morning.
And she is one of our sales and marketing managers. And we are excited to be here today because today we are featuring our airway trainers. And just before we get started, I do want to make mention that we do not have any way to assist with any Zoom technical difficulties, but not to worry, as this session is being recorded and you may view it at a later time. I do also want to make note that there is a chat window in Zoom there. So if you have any questions along the way, feel free to put those questions into the chat, and Melissa is going to be monitoring that, and we'll be happy to answer those questions throughout our session. So without further ado, I think we are ready to get started. Khaled, what do you say? Are you ready?
Yes, we are.
Okay,
Let's do it.
well, let's begin. Well, as you can see, we have a wide selection of airway management products. These are ideal for training anyone requiring airway management instruction. This includes respiratory therapists, pre-hospital EMS, emergency room personnel, and long-term care facility staff. Well, let's not forget, we have schools and universities and colleges as well. Out of the box, these airway management trainers are fully assembled and ready for use. Today, we will show features of our infant, child, and adult airway management trainers. Each of these trainers come packaged with the lungs, the stomach, lubricant, and of course, an instruction manual. Laryngoscope, blades, ET tubes, BVMs, and other airway management devices are not included. These may, of course, be purchased separately. Well, great care has been taken to create airway management trainers that are durable, lifelike, and anatomically correct in respect to both size and detail. Landmarks include the tongue, oral and nasal pharynx, the larynx, epiglottis, adenoids, false and true vocal cords, cricoid ring, tracheal rings, the trachea, esophagus, the lungs, and of course, the stomach. When pressure is applied to the esophagus, to the cricoid, cartilage changes the position of the trachea and closes the esophagus, allowing practice of the Selleck maneuver. Each of the airway trainers you see today also have the jaw thrust feature. Now, these trainers allow practice of oral, digital, and nasal intubation, as well as the ability to practice suction techniques and proper cuff inflation. Devices that we will be using today are endotracheal tubes, and we have one for the adult there that Khaled is showing, and that is a 7.5 millimeter. And we also have a child tube, and that is a 4 millimeter. Also shown today will be the esophageal gastric tube airway. Okay. Additional devices that are not shown today, but which are compatible, are the esophageal airway, pharyngeal tracheal lumen airway, and laryngeal mask airway. Well, here we have our LF03623, and this one is our Lifeform brand infant, and its approximate age is that of a 6-month-old. Khaled will be showing us here the mouth, the gum line, and complete airway. This infant has a slightly larger mouth and airway, and as you can see, the mouth and vocal cords are more pronounced. Well, Khaled now will show us how the task trainer has been designed to work. Khaled, what do you say? Shall we intubate? Okay. So now, as you can see, be sure to apply ample lubrication. And you may take your time during this part. So Khaled has successfully intubated here. And let's take a look. With a BVM, Khaled is going to show us that he has successfully completed this procedure by the 2 lungs there. They are inflating. So that is exactly what you need to see, the 2 lungs inflating. Very good, thank you, Khaled. You know, now let's show our viewers what it looks like when we do not intubate correctly, so that we may see the difference. Once again, with the BVM, Khaled is going to just show us here. And as you can see, we have the stomach this time inflating. And this, of course, is what you do not want happening. You want it to be the lungs, not the stomach. Okay, thank you, Khaled. Well, let's move on to our next infant. Here. The next infant we will show you is our Simulades brand infant, and that is our part number 101-130. Khaled will show us here the mouth, throat, and esophagus. And you can see the difference on this one compared to the one we just saw. This deluxe infant airway trainer has a more durable material, and due to its translucent property, allows a lifelike illumination of the airway and neck. This means the vocal cords are highlighted for easy viewing. And an added feature of this deluxe airway trainer is the tongue swelling feature for more advanced airway management skills. So Khaled here, he is showing us the tongue swelling feature. Okay. Well, let's move on now to the child airway management trainers. We will begin with the Simulades brand airway trainer. And this one is our part number 101-125. And this trainer represents the anatomy of a 3-year-old. The trainer has all of the anatomical landmarks presented earlier, along with teeth. We additionally have a 5-year-old trainer, and we will show that in just a moment. And our 5-year-old trainer is from our Lifeform brand. And there it is there. And that one is our part number LF03609. And on this one, you can see that it has a manual carotid pulse. Carotid pulse. So Colette, let's show them the carotid pulse. So that's an additional feature on this one, on our 5-year-old. Okay. Well, before we move on to adult airway trainers, let's take a pause and ask Melissa if there are any questions in the chat.
Good morning. We do not have any questions in the chat this morning, but I'll alert everyone that we have posted a Word document that shows all of the parts we are showing today, in addition to links to both the USA and global websites.
Okay, thank you, Melissa. Well, our next trainer here is our Lifeform Airway Management Trainer. This one is our Advanced Airway Larry, and it is our #1 top seller. So if you're looking for the top selling product, it is right here. This one is the part number LF03685. And this trainer has a larger airway than our original adult airway trainer. And it includes the advanced airway features of tongue edema and laryngeal spasms. Larry also has constricted, dilated eyes. So Khaled, let's take a look. You can see the dilated eyes there. And we have the mouth. Yeah, there's the eyes. We have mouth and teeth and a complete airway. Laryngeal spasms and tongue edema are manually simulated through the use of 2 tubes connected to each with the use of included syringes. So here Khaled is showing us the tongue edema and how to perform laryngeal spasms and inflate the tongue. This trainer may be used as a standalone trainer or as a replacement head for any CPR lean, airway Larry, or adult crisis torso or full body mannequin. Khaled will now demonstrate for us how to perform correct tube placement. This can be checked by a practical inflation test. So Khaled is lubricating the tube. Once again, using a 7.5 millimeter endotracheal tube there. With the BVM, you can see the lungs inflating. Once again, if you see both lungs inflating, that means you have performed the procedure correctly. Okay. Well, we do have an alternative to this one here, and that is our Simulades brand adult airway trainer. In just a moment, we'll see that. That is our part number 101-502. As you can see, the head and airway are far larger than the one you just saw. and is made of a more durable material with translucent properties. This allows for lifelike illumination of the airway and the neck, and the vocal cords are also highlighted for easy viewing. This particular trainer also includes the advanced airway features of the tongue edema and laryngeal spasms. Laryngeal spasms and tongue edema are manually simulated through the use of the 2 tubes connected to each with the included syringes. And of course, this one actually has breakaway teeth. So let's take a look at the breakaway teeth there. So that's a nice additional feature. In addition, this trainer offers practice with cricothyrotomy, the cricoid area replacement skin. This allows teaching and practicing surgical airway techniques. Okay, well, I think we can pause once again to see if there are any questions.
Good morning. We do have one question we are looking to have clarified. On the previous head, the function of the tubing with the bulb attached, what do you use the bulb for? Again, that is for the manual carotid pulse feature. And that's the only question we have posted in the chat. If anybody has additional questions, please feel free to use that chat function.
Okay, great. Thank you, Melissa. All right, we're moving on to our final adult airway trainer then. And this one is our part number. Okay, just one moment. We are just getting our camera view set up here. And yes, as Melissa mentioned, if you do have any questions at any point in time, feel free to put those into the chat. We'll be happy to answer them for you. And once again, you know, the airway Larry that we've shown previously, that one is our top seller. We do have that question come up quite often. Which one do you recommend? And we always recommend the airway Larry there. Okay, we're going to take a look here. All right, so as mentioned, this one here is our final adult airway trainer, and it is our part number 101-501. And it has a sculpted alveolar sac, bronchial tree, and blood vessel structures of the cross-sectioned and exposed flexible lungs to the interior main bronchus and oral nasal pharyngeal spaces. The trainer also includes breakaway teeth. We can show that here. Khaled has them there. It also has tongue edema and laryngeal spasms. So we are going to show you again how to swell the tongue here. So Khaled has it. We will pull the syringe plunger out to the maximum volume and connect it to the yellow valve tubing, which he has done. And you push the air out of the syringe to inflate the tongue. So let's see that again here. So insert it into the yellow valve, maximum air to inflate the tongue. To release the air, you simply deflate the tongue using the same syringe. To swallow the larynx, only use 10 cc's of air and inflate through the red valve using the same technique as the tongue. The stomach will swell with esophageal intubation or excessive pressure with the BVM during rescue breathing. Once the ET tube has been correctly placed into the airway, you will be able to auscultate sounds. Okay, well, to recap, the airway management trainers you saw today all have durable, lifelike anatomical features, which are needed for proper training of our airway management skills. They come fully assembled, ready for use, and include up to a 5-year warranty. It is time to take airway management to the next level. Are you ready? Well, okay, at this time, we would like to ask if there are any additional questions. Melissa?
Good morning. There are no further questions in the chat feature. We've got an all clear message and a thank you already. Nice work, team.
Well, thank you so much. Well, if you have any additional questions or need more information, feel free to reach out to your sales or regional managers, and they'll be happy to assist you. We are also present on our social media pages. We have Facebook, Twitter, LinkedIn, Instagram, and of course we have YouTube. So it's a great resource for videos and anything else that you may need. And yeah, on behalf of NASCO Healthcare, it's been a pleasure. Thank you so much for joining us today. And we look forward to seeing you again next time.
Thank you.